right. Good afternoon on this beautiful fall morning. Wanted to welcome you all to the Inclusive Excellence Council. And as always, we will start with our land acknowledgement. And Diana Martinez, the director of LEO, has graciously agreed to read the statement today. Thank you, Diana.
Sure. Hi, everyone. So founded in 1889, the University of New Mexico sits on the traditional homelands of the Pueblo of Sandia, the original peoples of New Mexico, Pueblo, Navajo, and Apache, since time immemorial, have deep connections to the land and have made significant contributions to the broader community statewide. We honor the land itself and those who remain stewards of this land throughout the generations, and also acknowledge our committed relationship to Indigenous peoples. We gratefully recognize our history.
Thank you so much, Diana. And I think, again, this is so important for us, again, to recognize our history, the land, those who have come before us in this way and many other ways. So thank you for that. Okay, we're going to go into our next piece on the welcome, acknowledgements, announcements. And I will let you all know, again, just make notice we are recording the meetings, and really want to appreciate and just make a notice here and an appreciation to Teresa for finding the closed captioning piece of Zooms to bring this to our attention, and Ali for making sure that we're utilizing that moving forward, and it's starting today. So thank you both for that. And I believe it's in advanced settings for those who may want to use it in the future for their meetings. Okay, next slide, please. We have a thank you to Lucia Vulcan, who has served as the inaugural co-chair of the Community Engagement Committee and is stepping down in that role for now to concentrate on her student duties and success there, but a very sincere appreciation and gratitude to you, Lucia, for your service, and looking forward to continuing to work with you as an at-large member in IEC. So thank you very much. And the next slide is a welcome. And in terms of the leadership role, Javier Rios has now been selected as the co-chair for the community engagement co-chair position. So thank you so much for your leadership here, Javier. You're program director for the UNMAID's Education Training Center and senior program manager for the ECHO Institute. Again, thank you for stepping up into this leadership role and your continued very active engagement with the community. Javier, are you with us today? Because now, of course, I can't see all the names. Oh, yes, you are. Would you like to say a few words?
Good afternoon, everybody, and thank you. Just glad to be a part of the committee, and definitely have appreciated being engaged in the communities that I worked in here in New Mexico. I was born and raised in Santa Fe, and I have lived most of my life in New Mexico and love our communities and always want to help folks, no matter what they're trying to do in terms of bettering community outcomes, and especially from a health perspective. So I appreciate the ability to participate and create change wherever I can. Thank you.
Thank you so much, Mr. Rios and Javier. Thank you. This is a time again for us to share here. If we have updates or other items we want to share, but I'm going to turn it over to Dr. Sanchez for a moment, who is going to just give a brief update on our Heritage Month activities right now, and a current posting that is related to DEI for us as well. Dr. Sanchez?
Hi, well, as many of you know, October is Disability Heritage Month, and I'm excited that one of the co-chairs is here, Ingrid Hendricks, which all of you know, who gave a great session, moderated a great session with her colleagues just last week on disability culture. And Ingrid, would you like to share the two for this week?
Sure. This evening at 5 o'clock, we're going to have a session related to integrating disability content into the graduate curriculum. And we're really excited to have Corey Poffenberger, who's new to, I think, emergency medicine. She came here recently from Stanford and had had a lot of that curriculum in the medical school there. So she's going to be talking about her experience. Eric Kruger from the PT program is also going to be talking about some initiatives that he wants to get started in the PT curriculum. And I'm going to talk about some of the things I've done with UNM School of Medicine curriculum. So really excited about that. We're also interested in perhaps starting a community practice related to that. So anyone who attends, we'd love to hear your comments and interests. So looking forward to that. And then on Thursday at noon, there will be a panel discussion with numerous people from the disability community related to COVID and an after action report. And that will be led by Lisa McNiven, who also gave the presentation on disability culture. So that'll be happening again Thursday at noon. So hopefully a lot of people can attend those.
Thank you so much, Ingrid. And again, tonight's session is at 5 o'clock, right? And I believe Ali dropped into the chat the registration and information there too for people. Thank you. It was such an excellent session, the first session.
And Dr. Morales, if I can have a second to just actually thank Ingrid, actually is part of Disability Awareness Month that she suggested closed captioning for the Zoom sessions. And then provided the instructions for us all to set it up, and I shared those with Ali. So
it started with Ingrid. Oh, thank you so much, Teresa, for acknowledging that. And I didn't know that. Ingrid, thank you, because we didn't know it was there in all of those, the next layer of other settings here on Zoom. So thank you so much. And thank you, Teresa.
Yes. And if we haven't already dropped that link, we'll certainly provide the website. Oh, there it is. Disability Heritage Month. You can register on the Office for Diversity, Equity, and Inclusion website under Celebrating. And that'll continue to be the place to find registration for all future Heritage Month celebrations.
Thank you so much again. Okay, great.
So in follow-up to that, just as a reminder, November is Native American Heritage Month, Indigenous Heritage Month. We already have a number of great speakers as well. We'll be posting that calendar shortly. However, since all of you are rolling out great events within your entities, if there's any events that you're organizing for Native American Indigenous Heritage Month, please share so we can have Jose Rodriguez posted on the November calendar. So you can just drop it in the chat box and we'll follow up with you. As Dr. Romero-Leggett mentioned, the Office of DEI at the School of Medicine is expanding. We've already posted a position this past Friday for an Assistant Dean of Diversity, Equity, and Inclusion. It's currently set at 0.5 FTE. The primary responsibility of this individual will help with what has been requested by many members of the 20 academic departments, which is increasing diversity and inclusion, especially amongst our residents, fellows, and our faculty. So this person will be particularly tasked with rolling out holistic review and helping individuals gain positions and be promoted all the way to senior ranks of full professor and tenure. It's an important thing to keep in mind. It's written in the description for anyone who's interested in applying, but also as you encourage others to apply. Thank you.
Thank you, Dr. Sanchez. Appreciate that. Are there in the next couple minutes, any other announcements that people would like to make at this time?
Yeah, hey, this is Cameron. We do have our LGBTQ Health Summit coming up in November. I will get you all the specific date and time. I'll drop it in the chat. I'm sorry, I'm traveling. It's a little hard for me to get that well organized, but I'll put it in the chat.
Thank you very much, Dr. Crandall.
Dr. Romero-Leggett, this is Fabian. I wanted to just point out that our new director for community engagement for the hospital's on the call. So I don't know if now is a good time to introduce her if you want me to wait.
Yes. No,
Okay.
that would be great. No, please do.
All right. So Millie, oh yeah, there you are. Please introduce yourself. So this is a new role, and this is our person who's going to help us advance our efforts.
Thank you.
Good afternoon, everyone. My name is Millie Castañeda Ledwe. I joined UNMH last month in my role of Director of Community Engagement. And our mission for this goal is just, work with the stakeholders internally and externally to make sure we provide we improve the well-being of, New Mexicans. So we are still in early stages of, our strategic plan for the department, but it's exciting. I've been meeting with a lot of colleagues and learning about, the different sister institutions, HSC, Cancer Center, and then it just trying to reach as many people as possible so we can, join forces to work in the community engagement. So I'm really excited to join IEC Council. So thank you for having me here.
Thank you and welcome. We're so happy to have you here and look forward to working with you and having you as part of the council as well. Great. Thank you for that. I'm going to go ahead and move us along in our time. If there are other shout outs or information or things to share, please feel free to drop them in the chat. And we'll make sure that they're part of the information going forward as well. And I believe somebody said Dr. Montoya had her hand. Did you have Dr. Montoya? Please go ahead.
Yeah, I wanted to quickly just have a suggestion for Native American Month in November. Last year we had Dr. Moss out here who did a fabulous presentation. And I wondered, Dr. Romero-Leggett, if you in your position could reach out to Deb Haaland. And I was thinking it would be fabulous if we could get Deb Haaland to speak next month, and she could do it by Zoom. I imagine her schedule's like,
great idea. Yeah.
If we can have Deb Haaland speak, I think that for all of HSC, it would be a fabulous talk.
No, thank you for bringing that up.
Someone of your position would be like the perfect person to make the invite.
Oh, I think that's such an excellent suggestion on behalf of all of us and everything. That's wonderful. Thank you, Dr. Montoya, for bringing that up. And I know we have some great connections here too within our group, but thank you. I definitely will make sure that we reach out. Thanks. Okay, great. Well, we'll move on. Oh, go ahead.
Follow up on that, because we thought about that too, Carolyn, and I think it's a great idea. All of those requests have to go through the DO. So I think, if you would be willing to do that, Dr. Romero-Leggett, that would be fantastic. Because I mean, in her new position, it's going to be a little bit more difficult to get that to happen. But I think that's a wonderful idea. And I'm glad that you're thinking of that too, Dr. Montoya. So let's see, it'd be awesome. Yeah,
great. Thank you. Okay, let's move into our committee reports. And the committees today will be sharing a few of the highlights that they learned again. Just to remind people, we have a historical report coming forth that will be shared with the HSC community and our core group leadership here before the holidays. And want to very much appreciate the leadership here of Dr. Sanchez and helping us pull this together and all of the different meetings that he's having with our co-chairs. But appreciate and gratitude to all of you for putting forth the information and going back and looking at information and finding it and questioning. And it's just so important. The reason that we did this, all of us, as we were moving forward, is because it's so important to know where we have been as we start looking for, to our forward movement and where we're going to, where we want to go next. Right. And so it's just such an important part and just critically important to us just to honor the historical as well and celebrate that and identify where we have gaps. So again, really critically important work. We appreciate it because it's not something that's just right there, right? It hasn't been done before. In bits and pieces, there's information, but this has taken work. And I really want to acknowledge and offer my thank you for that as well. So the committee reports today will give just a little bit, they might highlight something that they want to just share that they learned. And then also, of course, any updates since the last meeting. And we'll be spending probably at this point anywhere from 3 to 4 minutes on this piece by committee so that we can make sure we get our DEI executive officer time in here too. So we'll go ahead and start with our community engagement committee, Dr. Flegg and Javier. Mr. Rios, on your report. Thank you.
Thank you. I don't think Dr. Flegg is here, so I'll just go ahead and start. So I think we've shared this several times, but we have looked into the different areas of UNM HSE in terms of what is happening in terms of community engagement. And what we've learned is kind of what has been shared in terms it's a new effort. There isn't like a unified strategy. There isn't sort of a unified definition of what we're defining as community engagement. And then looking at both internal engagement from our UNM community and then external with community partners. So those are all things that we have learned and then also look forward to building as we're going forward. And so I will share that since the last time and it was actually yesterday, I got to meet with Millie, who is on the call, who just introduced herself. And I feel like we had a really good conversation. And for me, formulating like thoughts around community engagement from the university as a whole. And I know we've shared this before, but I think having a more formal tool or way of tracking community engagement. And then Millie was sharing a resource with me, which I'm going to share in the chat, which is the Community Health Needs Assessment by UNM. And maybe this is like the future of the different areas of UNM, like actually having a much more formal way of assessing how we work with community and then following up, right? Once we engage with community, what are the steps that we report back to community in terms of what we're doing? Following up with the things that we say we are going to do so that we hold ourselves accountable. And then really differentiating between like internal engagement. Millie shared this with me yesterday. For example, the hospital has an employee engagement person, right? So that's internal. And then at the same time, what entities have that internal engagement person, and then also a community engagement, which is for more external facing activities. I feel like since the last time, that's one of the big things that we've done. And then also, obviously, the changeover of myself being added to the committee. So we're still gathering information. If anyone has any information that they know of efforts, I think like we shared the last couple of times, it isn't very formal university wide. So maybe that's also something that we're looking forward to, is having, a sort of a unified effort and like a starting place. So here's how we define community engagement as UNM. And here's what how we follow up with our community of partners. I do know since the last meeting, we are also looking to add more folks to the larger committee when we meet in terms of community engagement partners. So if you know of anyone that you would like to recommend, please reach out to us. And I don't know if anyone else wanted to add anything from our committee, but that is all that I had for today.
Thank you, Javier, an excellent resource. Thank you for dropping on the chat and for sharing that, Millie. Anyone else from the committee have any additions here?
Dr. Romero-Leggett, once again, I want to thank Javier for stepping up and supporting these efforts and for his committed leadership over the years. And of course, thanks to Dr. Flegg and Lucia for their contributions. I've been thinking about all of our discussions, and Javier, I was thinking about the conversations that we've had around the commitment of the University of New Mexico to community engagement. And again, I appreciate that the Inclusive Excellence Council has elevated community engagement to one of our primary pillars. And again, how do we make certain that community engagement is honored in performance reviews, tenure, and promotion, that we're not just performatively acknowledging community engagement, but that it's genuinely ingrained in our culture and all of our efforts. And so I've really been listening to our community and to our committee, and I appreciate that they courageously have brought these issues forward and that we are all committed to moving forward.
Thank you so much, Dr. Rival. Very much appreciate that and the work of the committee. We'll go on next to our Academic Development Professional Training Committee, led by the co-chairs, Ms. Hendricks, Dr. Magaf-Madueña, and Mr. Hayek. For whoever would like to, I'll turn it over to your committee.
Thank you, Dr. Romero-Leggett. I believe I am the only co-chair here. It's kind of hard to see all the faces. So anyone else on my committee who wants to chime in, I'm happy to have some additional feedback. In terms of the historical report, it's just really encouraging to see how many different programs are really doing a lot of work in this regard and really bolstering their curriculums in terms of making sure that DEI issues are not only included in their curriculum, but are a natural part of the curriculum, not some sort of add-on. The health profession programs, they have started a DEI subcommittee that has representation from all the different programs, and they bring back information to this group to talk about what's going on in the programs and share educational efforts. The PA program recently got a HRSA grant to increase the recruitment of their students and faculty from more diverse and traditionally underrepresented backgrounds. So that's going to really help in terms of developing new curriculum related to population health and decreasing health disparities. College of Population Health, not surprisingly, is doing a lot in this area, creating a values vision for anti-racism for the college. They have 5 different working groups that are working to address anti-racism, education policies, climate research, and community engagement. And all of these groups are working on long-term plans for the development of explicit competencies related to DEI topics. And they're developing a core set of resources. And I know Dr. Nervy was talking about an assessment that they're developing that she's going to share with us when that gets less drafty, when she gets that more pulled together. College of Pharmacy has been working with faculty to self-assess their curriculum. And I know a lot of different groups have been working on the assessment of their curriculum. And I think another initiative that would be good to have, and I've mentioned this, I think, before, is having open access resources that are available maybe through our institutional repository that people could share and contribute, kind of like MedEd Portal, if anybody's familiar with that, where people could put resources and be able to share them so everybody's not reinventing the wheel. So that's something that I think we can work on going forward. And lots of other, I don't want to take up a whole lot of time with this, but just been very impressed with all the work that's going on in all the different programs along these efforts. And we're looking forward to developing some real action goals going forward, rather than just collecting the information, but developing some action items that we can do going forward. So anybody else in the committee who wants to chime in, would love that feedback.
That's excellent. Really appreciate all of that work. Did someone?
Elena was going to say something. I think she got.
Oh, Elena,
no,
dear one.
It wasn't that important. I mean,
no, please share.
Just the School of Medicine as well. So we just had a really amazing session by Dr. Vallejos about the holistic reviews for medical students and how it's increasing underrepresented minorities in our entering classes. So I was just really proud of that as well.
No, thank you for bringing that forward and how important that is, again, for our students, residents, faculty, all staff hires, everyone, that, you know, that we're doing things in a holistic manner. is really critical. And, Dr. Ballejos is a national leader in that arena. So please, everyone, reach out or just know that she's here and very accessible and always willing to help in that. Thanks for bringing that up, Dr. Bissell. Thank you. Well, that's great. And I love to, again, anytime we can also find a place, right? And whether we're going to do that through a repository or whatever, but where we can start making sure we share things publicly and have things, like you said, so we don't, so everyone knows where to go and we can start sharing things as a collective. So thank you for that. Okay, we're going next to our Culture and Climate Committee, Dr. Salazar and Dr. Crandall. Thank you.
Hi, Dr. Romero-Leggett. This is Krista.
Hi.
Thank you for the time to share this report to everybody. And anybody who has anything to add, I'd love to hear from you. What I'm going to be sharing with you all is the historical report and how the Culture and Climate Committee is contributing to that with Dr. Sanchez, and then the UNM HSC survey update. So as far as the historical report, we had a bit of a slow start as a group, and Dr. Sanchez was very generous to us in giving us an extension on our deadline. We have a hard final date to get all of the information to him by this Friday. And the data that we're collecting are from all of the health sciences programs, which is the College of Pharmacy, College of Nursing, dental programs, public population health programs, School of Medicine and health professions programs, as well as biomedical sciences graduate programs and UNM Hospital and SRMC. So I want to share with you all the individuals who are collecting this data because they may still need help in collecting the data. I'm collecting the data for the College of Pharmacy, and those that are helping me are Crystal Ward, Dean Godwin, and Joe Anderson. Angelina Rodriguez has taken on the collection of data for this College of Nursing. Pri Sarangarm has taken on the responsibility for collecting data for the dental programs. And Javier Rios has done this for the public and population health programs. And then Cameron is doing School of Medicine. And we had discussed individuals who will be collecting this data for the other groups as well. So you guys may be wondering, well, what data are you collecting? And the information we're collecting is when those programs were established, the degrees that they offer, and what's involved in those degrees. So a little bit of background and history. We're collecting data also on admissions process, the remediation process, course offerings and required course modifications in the past few years that are significant to that particular program. And then curriculum committee participants and program committees. And then any sort of data or programs or processes that impact the climate, like has there been a new dean, or are there new pipeline programs or new outreach programs? And so that's our contribution to the historical report. And then the survey, Dr. Romero-Leggett, I don't know if you want to share it with the group, the information about the survey.
Sure.
And where we're at with that.
Sure. Just a very, very brief update because it's a little bit of information, but we're moving forward with the procurement process in terms of, again, identifying our vendor. We have endorsed, the Rankin Group initially, again, as after the work that was done by the subcommittee in the past year and a half, but we will again go through our RFP process. Teresa Madrid is helping lead those efforts and right now, and we will update you all. But again, as far as we know, without everything being formal, if Rankin were to be the vendor, we would look to put together a working group in the next several months and focus groups in the spring for the Health Sciences Center, and then launch the actual climate survey in the fall of 2022. So we will keep everyone updated, and obviously our Climate and Culture Committee, and thank them so much for some of our quick little updated meetings to move this forward. And Teresa, thank you for helping us get this moving forward as well. So thank you for that great update and the information on that, Dr. Salazar. Anything else to be added by any committee members? And then we'll move on to our final committee. Great.
Dr.
Okay.
Merrill, I'm just curious if that's a sole source agreement or an RFP.
Right now, they're determining that, Dr. Regal.
Okay, thank you.
Yeah, thank you. Okay, Workforce Development Committee, Dr. Smart and Dr. Singh.
Okay, cannot unmute myself. I'm not sure I see Dr. Singh here, so I will go ahead and do an update, and then I see a couple folks from the subcommittee, so if there's things folks would like to add. Our primary, I think, update as well as ongoing endeavor is collecting information about professional development and workforce development training opportunities across the HSC. I'm going to take a moment, advantage of everybody being on here, and say if you'd like to add anything, there's a Smartsheet link right here. Just click it open, keep it open on your tab for after the meeting. We are just gathering as much information about what is available for all levels of our workforce, which is another aspect that we're looking at doing a definition of what do we mean by workforce for our subcommittee. It's probably part 2 or maybe the exact same time as this task. This will be information that certainly will be helpful for the historical document, but also an opportunity to create a home for this. Probably the biggest thing, so far we're up to about 34 different activities that we've captured across the HSC. But the biggest piece is also figuring out how do we ensure that this information is known and available to all. And so figuring out how to disseminate it in a way that's useful for the workforce. So not only that the information is available, but that people feel like they can access it and know what to do with the information too. So the other piece is that we'll move into as we finalize this action item is understanding a definition of our workforce, which I think will guide future steps that we have in our committee too. Anyone else from the group like to add or any questions?
I think Dr. Gonzalez had a question in the chat. If you're interested in professional development opportunities for trainees, postdocs, residents, undergraduate students.
We'll take them all. We'll figure out what to do, and because we haven't, it has been a conversation we've had. What are we implying about our workforce? But I think that we've added some fantastic colleagues, and Amy and Octavio, to our group to really recognize that I think we are conceptualizing workforce to be earlier on in the pipeline, not just the workforce that we have here. So let's put them all in there. Just put them in there. The more the merrier. We'll figure out what to do with the information.
Yes, love it. I love it. Yeah, thank you. Any other committee members like to add anything, or just think it's, again, thank you for putting that in there, and we'll make sure that we have that link as well in the information shared. So thank you. All right, and I think appreciate that. Thank you for the report out. And I'm sorry, I know I saw Dr. Singh earlier, but I don't think I see him now either. Lindsay, thank you to all of the committees and the people that you've been reaching out to. I know that many more, all of the committees are going to be looking to both reach out to content expert advisors as well as continue to welcome people to the committees as we move forward on this great work. The next piece that we're going to do is have some sharing from our diversity DEI executive officers, sharing one or two of their priority initiatives within each of their entities. And then we're going to look forward in an upcoming meeting to hear from our at-large members as well. So we're excited about this. And again, thank you for the work from my DEI executive officers. So I'm going to begin with, and I know, you know what, Dr. Montoya had to step off. And I don't know, is there someone here from College of Nursing that was going to report out on that? I don't think so today. If there is, please just let me know through the chat or speak up, but we'll move to Dr. Salazar. Anything that you'd like to share from College of Pharmacy in your DEI executive officer role?
I'm not quite sure what you want us to share. I'm sorry.
This was any of your, if you had a priority that you wanted to share with the group DEI related in your role as the executive officer within the College of Pharmacy.
Yes. Okay. So our priorities are to increase anti-racism and other DEI components within our curriculum, and it's DEAI. Also to increase the degree of inclusion for all of our stakeholders, which we consider to be faculty, staff, students, alumni, preceptors, and increase the diversity of our faculty.
Thank you.
So that is what we're focusing on at the College of Pharmacy.
Okay, great. Thank you for sharing that. Okay, Dr. Nurvi from College of Population Health.
Good morning. Our priority is anti-racism. We are, and also anti-racism more in education. We have 5 working groups in different topics of anti-racism, but the group that I chair, the education anti-racist group, is the one that has more, I'm not saying more importance, because the policy group is real, addresses the structural problems in related to racism, anti-racism, but the education team is the one that has a much more clear target because it deals with the curriculum of the bachelor's, the undergraduate, and the MPH program. And as Ingrid reported already, we are developing a narrative that is going to be all the students and the instructors will have to at least to address, read, and discuss a corpus of about between 10 and 15 articles or videos and other resources. And the narrative will have about between 10 and 15 pages, and will are covering the historic. We have an outline that I'm developing, and we are covering from the origins of racism towards racism today in New Mexico, going through the anti-Blackness, anti-Latino, anti-Indigenous peoples, and how did we get here. And we are producing a tool that has a toolkit that has 3 tools on it to evaluate. One is a self-assessment tool to evaluate the anti-racist components on our syllabi. And the second and third are how do you set goals for anti-racism teaching and inclusion with the learners and among the instructors. As you know, we are a very small college that is growing exponentially, and the full-time faculty, I think now we are 14. I don't know if we are even 14. And most of our instructors are part-time instructors, and we cannot decide on their time to produce what we have the responsibility, full-time faculty, to produce. Our anti-racist activities include staff and the leadership from students, and we plan to make an extensive to all learners interested. We think that we will be ready to implement this change beginning in spring 2022.
Thank you.
Of course, we are going to share with you all the narrative and the self-assessment.
We look forward to that so much, Dr. Nurvi, and thank you all for this trailblazing work as well in this College of Population Health, and very appreciative of that, and look forward to hearing more. Thank you. Hey, Dr. Thank you. Dr. Levi is going to report out for College of Nursing as Dr. Montoya had to step off.
Oops. Thank you. We identified two things. One was increasing the diversity of our faculty. And the second one is to increase the diversity of our student body. Our undergraduate students are very representative of New Mexico, but our graduate students, not so much. So we need to do some more focused recruitment to the underrepresented populations in the student body. So those are the two that Dr. Montoya and I have been discussing.
Thank you for sharing that very much, Dr. Levi. And any ways we can help there, but very excited about that as well in that work. Dr. Sanchez is our interim DEI Executive Officer for School of Medicine right now.
Yeah, I think a couple of the developments I would like to mention is, as you know, for Hispanic Heritage Month, one of the sessions was known as a Language Equity Summit. It's a continuation of our efforts to help our staff, graduate students, and our faculty build on their asset of speaking more than one language. And so one of the exciting things to share is that we will be posting a position in the School of Medicine. The assistant dean position, Amy, it was in the School of Medicine, and this position will also be in the School of Medicine for a director of bilingual education. And this really builds on a lot of work by others who have been championing helping our students, faculty, and staff develop competency and proficiency in Spanish, as well as our languages of our native communities. So once again, if you have anyone interested in applying, please have them reach out to me. But that will be posted at the end of the week. And I just want to thank everyone who's been doing this work and teaching Spanish and other languages to our graduate students. And also special thanks to Fabian. He's been helping me draft the proposal for this position.
Thank you, Dr. Sanchez, and excited about those positions and moving forward in terms of language equity as well. Thank you very much. Okay, Dr. Pondy from CTSC.
Okay, so hello everybody. The CTSC has a couple different goals that they're working on. First, our Translational Workforce Development Group is developing and piloting training on bystander intervention skills. And you may have already started to see some work, but it's unconscious bias when picturing a scientist and holding conversations about that as well. So we're very excited about those trainings, and they're starting to be piloted and then will be offered more broadly, hopefully across the HSC. Another two areas that we've been focusing on, one of the missions as a research center, of course, is inclusion of diverse populations in clinical trials. And so the way that we approach that is we actually have a community health specialist, Cynthia Kilo, who goes to health councils around our state and really tries to do work that builds a bidirectional relationship of trust. So she, for example, recently helped promote in Quay County a running program that was out there, and we got lots of people from the HSC to join and provide support to that. So it's not always just the research piece, it's about showing that we're like dedicated partners over time, and then understanding community priorities and then matching our research to what communities want. And so that's really been an exciting, I would say, newer development that we've been much more robustly building out. The last thing is about increased awareness of evidence-based research engagement methods for inclusive research. So I think being inclusive in what we do is really important, and there is a lot of work around the science of how to best do that. So we actually have a consultation team that we've built with several faculty who are experts in this area. It's a free consultation for anyone who wants to think about doing that, to build a program of research that we offer. And so we are working on that and putting tools out there in this area onto the website, as well as the ability to engage and get those consultations.
Thank you so much, Dr. Pondy. And love some of those engagement activities and that information you're sharing. Again, like all of the different DEI executive officers and things happening across the HSC, a lot happening there. So it's nice to get updated and learn from each other. Thank you. And next we have the UNM Medical Group, DEI Executive Officer, Ms. Helen Villarreal Nielsen. Welcome, Helen.
Thank you so much. So we're busy at work at the medical group. Really kind of did a deep dive into our Press Ganey engagement scores with our employee side. And one thing I really love about this group is it really got me connected with Dr. Singh over at SRMC, who's doing some similar work with Press Ganey on the patient side. And so maybe some collaboration opportunity there from both entities. But we also just completed our affirmative action plan. So doing a deep dive into that and where some pockets of opportunity could be on the recruitment side, on the retention side. But also there are stats that we're not able to capture because they're not asked in some sort of formal way. So I know this was also mentioned in the last meeting we had. I think Cameron Crandall recommended or thought of maybe some ways that we could be doing that. So I would love to collaborate on that as well, on how we can capture some of that information. And then just some internal processes improvements with our job descriptions, our compensation and other things to ensure that we are having some fair and equitable practices on that level. So those are just some overarching themes that we're working on at the medical group.
Great. Thank you so much, Helen. And then, like you said, here we're finding things out and you can reach out to certain people and ask and we can continue to collaborate across. Thank you for that update. And Fabian Armijo, Executive Director and our DEI Officer in the hospital, UNMH Hospital.
Thank you, Dr. Romero-Leggett. Hi, everybody. Good to see you all. A couple of things we're working on, as some of my colleagues mentioned, Native American Heritage Month is coming up. So we have a few things that we were putting in the works for that. We're going to be celebrating 15 years of Native American health services here at UNM Hospital. So we're going to showcase that. We're hoping to increase awareness so people know that we're here, we're in the hospital. That team is under my purview. I think I mentioned that last time. And we provide a lot of services for not only providers and nurses and everybody in the hospital, but also for patients and their families. So everything from food voucher to a discount at a hotel if people are traveling from out of state, lots of different resources. So we're going to do a lot of work around that. We are currently searching for a liaison who will report to Millie as part of her team in community engagement. We want somebody that has experience working with the Black and African American community. And this will be the third liaison working under Millie. So we're actively doing that. As we shared in I think Javier shared this in the chat, the community health needs assessment. Take a look at that. We're getting ready to publish our the strategies plan that we put into place. So that'll be coming out to report back to the communities to show this is what we've done. This is what you asked for. This is what we've done. So that's coming up soon too. We're working with marketing on getting that finalized. One of the other big things that's happening right now at the hospital is looking at our mandatory competencies. So every staff member has to take a competency every year. We're looking at our DEI competency to make sure that that is up to date. Typically, it was very heavy on LGBTQ matters, and that's still important to us, obviously. We're going to continue to include that, but we're adding in language services, Native American health services, all under one competency to be joined with health literacy. So that's one of the things that we're hoping to provide to our staff, a resource, right, to make sure that they're up to date on what we expect from the Office of Diversity. And not only that, but reminding people that we're a resource for hospital staff. So if something's going on and a leader doesn't feel like they can approach a situation with discrimination or racism, they can come to us and we'll partner with them to create something to help them. So we're hoping that that competency will help us get the word out there too on that. And I think that's it. We continue to identify employees who come from pueblos or who speak indigenous languages, because I'm so excited with the work that Dr. Sanchez is doing around Spanish with our Pueblo languages and those languages. It's different, right? Because if you're not from that community, you're not going to learn that language. Nobody's teaching that. They don't teach Pueblo languages outside of the Pueblo walls. So anyway, we're engaging actively with tribal leaders to continue to increase that. We have a couple more Zuni speakers that we've identified and a couple of Carrie speakers. So we just continue to try to increase the number of services that we provide to our communities here. And I think that's it.
Thank you so much, Fabian. And again, the discussion about, being resources, all of you as resources for the areas that you oversee. And then also, again, the language equity issue and the different languages. So thank you so much for that. And then Ingrid, Ms. Hendricks will be back to you as the DI Executive Officer for HISLIC, if you'd like to share a couple initiatives as well.
Sure. Two of our biggest initiatives are training. We're initially focused on our own staff, but realized that as a central hub for the HSC, it would be good if we offered these trainings to everyone. So any kind of trainings that we have available, we've increased the seats for those so that anybody in the HSC can participate in those. And I'll try and multitask here and put the link to that, our events calendar in the chat. There we go. And if you see stuff like on Zotero or PubMed or whatever, just keep scrolling through. It's got all of our regularly scheduled programming, but in addition, things about different things related to DEI. I know there's a speaker coming up soon that Dr. Salazar is one of her mentors and spoke very highly of. We're really excited to have her come, Dr. Skylar Walk. So we've got 77 seats left for that. So you can definitely get in on that. So please look through our list of events, and we're going to continue doing programming into next year. I think we have something set up in January. So yeah, anybody who wants to be involved, and thank you, Amy, for pointing out we had a transgender cultural fluency program on Monday that was really well done, really great. So please feel free to participate in those. Our other big initiative is making our space more welcoming. As I said, as a central hub for HSC, we have students, faculty, staff, all sorts of different people using our building. And we're working on signage that's more inclusive. You may have seen some of our banners with different languages. We have put in free menstrual products because we were hearing from students that was something that was really needed. And I know Amanda Collar had given a great presentation to us about research she's doing related to that. And just looking at some different things that we can do in the library to welcome students and make them feel like it's a more welcoming environment. We're hoping maybe next year to be able to offer maybe a food pantry space for the Lobo Food Pantry that we could host through the library. We're looking into possibly having a meditation sensory room in the library if we can identify some space. So just various things we can do to make our environment more welcoming.
Thank you so much, Hendricks, and the work there. I mean, those are just, love that we can all join in, and again, making sure that we're aware of some of these excellent trainings and sessions and dates. So thank you for sharing that. Dr. Singh from SRMC had to step off for an emergent item, but he wanted to share that they're working on organizing an event for Native American Heritage Month with several artists who have contributed artwork to the Sandoval Regional Medical Center, which I think for those of you who have been out there, just amazing artwork there from the surrounding areas and our sovereign nations. And he'll let us know more as they're able to schedule that and find the venue for that. They also are working on revisions to the admission form, their patient admissions form, and working with Fabian Armijo on a redo of that. So he'll be sharing that as it comes forth as well with all of us. And I think, I just want to make sure and look through my list. And I know that Dr. Wandiger-Ness, oh, yay, she is here. Dr. Wandiger-Ness, please share with us.
Hello. Sorry, I'm here to represent the UNM Comprehensive Cancer Center. And in that role, Dr. Gillette and I are submitting a new R25 with the support of Office of Diversity, Equity, and Inclusion. This is a continuation of research training for high school and undergraduate students who are American Indian or Hispanic. And so we're going to dovetail our efforts for research training and health careers training through a 2-year immersive internship opportunities for the students. We are also, that grant is gone in, so we'll see, hopefully. And then secondly, the NCI has issued a new set of guidelines for the cancer support grants that mandates diversity, equity, inclusion section. It's 6 pages. So that'll be new for the next renewal. We just got renewed, but anyway, we have to start working now, and I'm getting that committee together. We have some individuals identified, mostly in the clinical side of the Cancer Center, who have agreed to be part of this committee. But we have to formalize, the meeting times and all that sort of thing now.
So. Thank you so much. I'm glad that we could hear from each and every one of our DI executive officers. And again, I know we're at our hour here, and I just want to offer my thank you to the work for everyone here today for your work in DEI that you're doing and actively engaging in that work, both in everything that you do and through the IEC and being actively engaged with us. I want to just make sure too that everybody is, I hope, taking care of yourselves and maintaining your own health and well-being as well. And I just want you to please take a moment and please reflect and do that for yourselves as well, as we're with so much going on in the world today. And we're looking forward to our next meeting and hearing from our at-large members as well. But thank you all so much. And we'll try to make sure and see if we can leave a little more time in the future too for other questions, comments, and discussion a little bit in there too. But so much rich work and conversation here today and sharing. Thank you so much. You guys have a wonderful day and a great week too. Thank you. Bye.